Hello, and thank you for joining employer-sponsored health plans in a post-pandemic era. A few housekeeping items to keep in mind during the webinar today. All windows on this console are interactive and adjustable. Feel free to move and size them to make the webinar more personal for you. If you experience issues with the audio or video, please try closing any other applications or browser tabs and refresh this page. If that doesn't work, refer to the tools icon in the bottom for further technical assistance. And now, please welcome our moderator, Jeanette Bennett, founder and editor of Utah Valley Magazine and Business Q.
We are excited about our conversation today about employer-sponsored health plans in this post-pandemic era. I hope we're post-pandemic. We're going to be talking a lot about that today. We have three amazing guests, and I'm excited to have them introduce themselves to us today. So, Governor Leavitt, let's start with you.
Well, thank you. I'm happy to be with all of you. I have had three careers in my life. My first career was actually in the insurance business. The second was doing public service. I did state public service as governor, and then I was the Secretary of Health and Human Services in Washington, as well as the head of the Environmental Protection Agency for a time. Since that time, I've continued to work in the world of health. I invest in healthcare businesses. And as a result, this whole pandemic experience has been a matter of real interest to me. I actually gained a fair amount of exposure to this subject while I was in Washington. So I'll look forward to the conversation.
Thank you, Governor. Your range of experiences and careers will lend itself wisely to our conversation today. Thank you for being here. Next we have Tony Miller. Tony?
Hi, Jeanette, thanks. Unlike Governor Leavitt, I haven't been as prodigious. So I've stayed in health insurance my whole career. I actually started, confidentially, we'll keep it quiet, but I was an unpaid intern for United Healthcare when they were a small little company. I learned managed care there, and from there went on and did some consulting. Helped Kaiser Permanente buy and sell lots of properties outside of California. And as we were doing that, came upon a concept about how we could change the way healthcare works. And we pioneered what is now known as consumer-driven healthcare plans. And so we built the first HRA-based health plans in the late 90s. They were the progenitor to the HSA law. I had the opportunity to testify to Congress about how the products were working and what I thought they should do to promote this kind of product in the market. Grew that plan to 500,000 members really quickly, and then United Health Group bought that plan from me. I had the opportunity to then go be an investor. We run a venture fund called Lemmi Ventures. We invest in disruptive healthcare startups. That venture fund creates a thesis about something that we think could be fixing healthcare, and we try to then find the companies that could fit that thesis. One of the last theses we wrote was how to disrupt health insurance, and it's forced me to start my second health insurance company, which we call Bind, and it builds personalized health coverage plans for consumers that they get to define. And we're really excited about that, and I'm really excited about hearing from different perspectives on the panel today. So thanks for having me.
Thank you, Tony. What I notice in your background is that you're a solution-oriented person. You see a problem and figure out how to solve it, not just for yourself, but for all of us. So thank you for your work.
Thank you.
Lastly, we have Trent Savage. Trent, welcome to the panel.
Yeah, thanks, Jeanette. Glad to be here, especially with these two distinguished gentlemen. I currently serve as the Chief Human Resources Officer at Mountain America Credit Union, and had the privilege of working in HR for the majority of my career. Spent quite a few years with some of the larger enterprise companies. I spent some time with Procter & Gamble and Amazon, where I got to see some really interesting kind of insights in terms of their approaches to health and employees' wellness and benefits and those types of things. But really excited now to be able to help drive that in the organization that I support. Native of Utah, glad to be here and glad to be with you today.
Thank you, Trent. And I'm Jeanette Bennett. I'm a small business owner, so I'm very interested in learning what I can today about how to help my business and my employees. And I own a publishing company. I've been running it for 21 years. And so it's been a fun adventure. And I think let's start with the giant elephant in the room, in the world, the past 13 months, which is COVID. And I'd love to know from you, just with so many things changing, everything's been turned upside down. What have you observed within your organizations about how people's relationship with their health has changed? And Governor Levitt, if we could start with you.
Well, I'll speak as a person who's involved in small business myself. Our business is not a large business. We have about 100 employees. And we, of course, like almost everyone else, we have found ourselves out of the office. We've had to learn to completely operate differently. And to my pleasure and surprise, we've done it successfully. But I also think it has changed the way we think about not just work, but also our health. We've been so much more conscious now of the way poor health can be initiated. We've had to realize that the public health is a big part of our own experience as well, and that our own health in some ways is very much tied up with the health of the community. That's a new concept, not in terms of health academe, but in the context of all of our lives. We haven't given that a lot of thought. We've had to understand how our relationships can be changed, not just with health, but with each other. So this has been, I think, profound experience that none of us will ever forget. Hopefully we don't have to live it too many times in our lives, but it has clearly changed our view of our health and our working environment.
Absolutely. I agree with what you said. Trent, what have you noticed about what's changed with the way people relate to and think about their health?
Yeah, I would totally agree with Governor Levitt. I got to be honest with you. I remember very well sitting with the leadership team a year ago, starting to have meetings on a weekly basis and then daily basis, talking about this and just how fast things happened. And while us, like many businesses, had continuity plans, I don't know if our continuity plan was designed for a pandemic per se. So we learned a lot. And, we're kind of in a unique situation where we have, as a financial institution, we need to be open and provide support to our members. And, making decisions around whether they stay open or closed, we really learned a lot. And I would agree with Mike specifically about, I love that while this pandemic's been tough and challenging, some of the things that I love that have come out of it, I think it's really broken some paradigms down around how work gets done. The number of leaders in the past that had this mindset of it has to be done in the office, right, has really blown that up. And I think that's exciting. I think that's going to create some exciting changes. I think it's going to present some exciting changes and unique opportunities for us as we go forward. There's three things in particular I'd call out, related to healthcare. Healthcare in general for employees, your general employee, it's confusing. The last year, I think, has definitely helped employees have a better interest in understanding their plans. I think they've wanted to explore and understand better what the options they are and how they work. And I think the good news is it is driving employees to be more aware of and desirous of how they can have greater control over it. That's one thing. Another one is I really think COVID has broke down a lot of barriers around telemed, and virtual medical. And I've been excited about that. There's some really interesting statistics around how that's changed. The third one is just the mental health piece. I think it's become at the forefront of some of the things we need to be thinking about. I was looking the other day and I saw a statistic of June of last year. Nearly 40% of US adults claim to have struggle with mental health. So I think that's an important thing that we need to be thoughtful of.
Thank you for bringing that to the forefront. We'll be talking about mental health a little bit more throughout our time together today. And it is interesting, right? This forced experiment that we had that was instantaneous, like you just mentioned. We had to figure out these work from home options and how to be a leader and a teammate in that environment. So thank you. Yes, great explanation. And last but not least, Tony, what do you feel like has changed in people's relationship with their health this past year?
Yeah, well, I agree with the comments that have been said prior. Who knew that a pandemic could teach us so much, right? There's something I started doing with my team here at Bind and then with all the customers we work with. And I would pose this question early in the pandemic, and I would ask them, what's the single largest clinical weapon we have against COVID? And people would sit and think for a little while, and they'd say things like, I can't even say the drug right now. Or they would say, ICU beds or whatever. And I would say, no, the greatest clinical weapon we have is social distancing and masking. And I think what was so interesting to watch when people would stop and say, oh, yeah, I guess I didn't think of that, right? They didn't think about their own behaviors could be clinical. And I think, and so often we use that term clinical to think that that means somebody in a white coat with, significant training. And the truth is, health is really something we as individuals have much more control of than we actually understand and what we're taught. And so what was a very important lesson for me to teach people is to get them to start thinking differently about what it means to be clinical. And you even look at, even today still, like you look at what's happening with some of the surges, is it still, even the vaccine can't catch up fast enough to the fact that we still need to use good public health practices if we want to keep this thing at bay. And I think, so that's the other thing that Governor Levitt had mentioned, is this whole idea of how connected we are, right? And there was people at the very beginning of the pandemic would say, oh, this has never been seen before. And it's like, no, this has been seen before in the world, actually several times in history. It just hasn't been seen for 100 years in this country. But the reality is, it teaches us how connected we are, and that rugged individualism we have in this country really fought against some of that reality of, hey, at the level of public health, we all are connected, and we've got to respect that. And that liberty that you want to have is your liberty until it affects someone else's liberty. And unfortunately, passing COVID for some people is it could be death, and we have to recognize that as part of our responsibility in society. So that was the first thing we tried to do. I think the second thing that we tried to relate to people from a health standpoint is the two acts that immediately passed after the pandemic. So you had the Families First Act and the CARES Act. And I remember we had to huddle our whole team around, because we offer insurance coverage and they were going to affect us specifically. And so we read the acts and we go through it, and we were like, Biden doesn't have to change anything. And people were blown away by that. And they were like, what do you mean? And I'm like, well, so when you build insurance that's designed around conditions, instead of insurance designed around doctors, hospitals, and drugs, that's what we currently design insurance around. But if you design around conditions, COVID is an infectious disease. And so the way we covered infectious disease was, actuarially, the smartest thing you can do is to stop that spread as fast as possible. To do that, you would have to test. To make testing occur, you make it free to consumers. And so for us, it was a very simple concept about mapping health at a condition treatment level is intuitive and understandable to consumers. And I think that's where we have to shift this paradigm in this country to, which is, we got to stop thinking about the medical industrial complex has the answer, but we as society and communities can actually embrace the conditions we're all going to experience, and how do we find the right treatments and the right services to solve those conditions as quickly and as easily as possible. And then the third thing that the pandemic exposed really was, we do have inequity in healthcare, and you're seeing it play out in the statistics now with how COVID has differentially affected certain communities in our country, not just racial, but clearly socioeconomic status is one of the clear problems. And to me, that's something that we as the industry can't hide behind anymore. And we need to say, look, we've got social inequity occurring in healthcare, and we need to break that down, and we need to change that. And so the pandemic has really given us three amazing silver linings if we embrace them, to say we want to change the trajectory of coverage in this country.
Thank you for sharing that. And it is so interesting that all three of you pointed out a lot of good changes and trends that have come and will come from this difficult year. So thank you for helping us understand that. And also, I liked how you pointed out that everyone's taking responsibility or should take responsibility for their health and their understanding of their insurance and the choices they make that impact their health and the health of others. And another, I think, silver lining of this year is that we've all become more interested in science and economies and those things that are the headline news, but they do affect us so personally. So let's dive a little deeper into mental health. Trent talked about that. I know it's on all of our minds personally and with our employees and as part of health coverage. So what do you anticipate that we'll see long term as far as mental health when it comes to health coverage? We mentioned virtual options, et cetera. What's going to be the future of mental health in relationship to health plans? And Trent, if we could start with you on this one.
Yeah. You know, one thing that we took a look at was our mental health claims data for 2020. And we were up about 25% over a previous year. Think about that. That's pretty significant. And when you look at the external environment, you know, you've got, unfortunately, I think COVID was highly politicized, real, but highly politicized. We had a highly political, like tough year, right? We had social unrest. And so we have a lot of stress in our environments at the macro level. But then when you bring it down to the employee level, the individual level, you've got kids working at home doing their homework. So not only do you have to be an employee, you have to be a school teacher and a parent. And so, you know, 2020, I think, introduced a lot of stress for us in so many ways. And my guess is there's a good probability that some of those things won't go away fast. You know, we don't know what 2021 is going to bring and beyond, but I think we'll probably continue to see some of these disruptions. So I think it's important for us to be aware as business leaders that this is real and that we need to be aware of it for employees and also proactively addressing it. I think it's going to require us to engage in different ways with both our providers and our employees. I'm assuming Mike or Tony will probably speak a bit to the providers. So let me talk about the employee perspective for a minute. You know, frankly, what I've seen is that managers are not equipped to deal with employees that are having these challenges. And I think that's an obligation that we have as employers to help educate our employees on how to do it. Now, let's be real. We're not asking our managers to be therapists. That's not what we're asking. But what I do think we need from them really is two things: to recognize when employees are struggling or be willing to ask. And two, we need to provide them with the resources that we have as organizations to help our employees and then direct them to the appropriate resources. The third part of that is that as organizations, I think it is important for us to make sure that we have really good mental health resources available to our employees, professionals, others that can help them deal with a lot of these challenges that we're facing. I think one of the best things that COVID has taught us, as I mentioned earlier, is just virtual is more acceptable, which I think is great, because I think we can offer, a lot of us that have organizations that span across the country or the globe, you know, we don't always have the ability to do that face to face. So we can have real experts do this virtually, which I think is very powerful. As I mentioned, I used to work for Amazon. I know that one of the things Amazon has recently come out with is as an app, and it's an internal app for their employees that can be utilized for medical related issues. And I think we're going to see a lot more of that with organizations where we're just very methodical about how do we provide information to employees so that they can quickly and easily get information to help them. But I think one of the key things for us right now is really helping our managers build capabilities, and then also to make sure we're having good resources available.
Thank you for sharing that. Business really is people. Management is people. So understanding what they need, and right now that's mental health. So Tony, if we could talk to you a little about this, about mental health and how that coverage and virtual options, how you think that will play out going forward.
Yeah, it's unfortunate that we needed an act of Congress to create a mental health parity, you know, part of coverage. And again, if you take an epidemiological point of view, the onset of mental health is like the canary in the coal mine. And when people start to struggle with anxiety, depression, fears, it's going to lead to other manifestations of illness, right? And then generally they manifest in what I call what Western medicine is trained to go solve. Heart problems, cardiovascular problems, endocrine problems, all that kind of stuff. But the truth of it is, the root and the early indicator is really how are we doing mentally, and how are we feeling about our lives and what we're doing. And I think one of the things, again, when you change coverage and you start to think about coverage at a conditional level, not at a doctor, hospital, drug level, you're going to put mental health services at the top of the list of things that consumers need and want. And again, it's actuarially superior. It makes sense that you should want to treat those conditions early and often. And I'm a son of a paranoid schizophrenic mother who had to deal with what I call the stigma this country has about mental health conditions. And it's an unfortunate thing that we treat the illnesses associated with that as something that's just off the main path, and it's not. In fact, if you actually look at the incident rate of mental health illnesses and mental health problems, it's the highest thing in the country, and we just haven't serviced it in a way that makes a ton of sense. And so I think we work with a lot of Fortune 500 employers, and they recognize it, and they see like, oh my gosh, we had this immediate switch to virtualness. We didn't really have this opportunity to prepare people for what that meant. And early on, I remember even in our own company, we started having these groups of employees create these channels in Slack. We use Slack as a way to communicate in our company. And there was this, work from home Slack channel that appeared one day. And it was everyone identifying all of the challenges of, oh my gosh, I thought this was going to be this great thing, work from home, but work from home stinks. Like, I got to do my job. My kids are at home now too. Oh my gosh. And my spouse is home, or my partner's home, and we're colliding with each other now on our work days. And I think what people missed is there's a silver lining about it. We made it work, which is amazing. But we also uncovered like, hey, we got to have some more support and services in dealing with what I call the soft sciences of epidemiology, sociology, psychology, and as a way for us to improve the status of health for people. And we got to permanently remove this stigma of why is mental health thought about differently than any other bodily, illness that we could get. And I think we made a lot of strides in the pandemic. I'm looking forward to employers really leading that charge in enriching the benefit, and actually not doing it as parity, but over subsidizing it and over putting the services, quickly and easily attainable for consumers.
Tony, I appreciate your input, and especially for being personal, sharing that about your mom. My grandmother died by suicide when I was 10, and mental health has been a companion in our family in various ways, and it's very real. And again, one of the silver linings of the pandemic and of this past few years is that we've lessened that stigma, and we have more to go, more progress to make, but good things are happening. And I appreciate the people in the health industry helping us to do that and to talk about it. Now, Governor Leavitt, let's talk about mental health with you. What does it look like from your perspective as far as changes in health plans, et cetera?
You've heard two very good answers from different perspectives. I'll simply add that mental health is not something that is directly related to the pandemic, in this context that we have had a mental health crisis in our country for a long time. And the fundamental crisis isn't just the number of people who are suffering. It is also that our facilities are totally inadequate. We have trying to find mental health support is extraordinarily difficult for a person who's in serious pain. And we're going to have to find ways of enhancing that, find new models of care. And then I think what Tony mentioned is still true. We have structural biases in our insurance system, as well as in other parts of our health system that get in the way of adequate health care, mental health care. A third component I'll say is that this is something we share as a community. This goes a long ways beyond just health and health care. It's in law enforcement, it's in school, it's in employment, it's in virtually every part of the community. This was a crisis before, and it's now intensified.
Absolutely, you're right. As we remember what happened 13 months ago and things started to shut down, and Tony, you mentioned the working from home thing. I think at first it felt exciting to be home and not have to put your shoes on and all of that, but it became very difficult, and layer upon layer of difficulty within the family and under the rooftop. And so I love that we're having these conversations. Another thing that happened last year at this time is that a lot of elective procedures were not allowed. That very few things were allowed, only very, very essential procedures. And throughout the year, people have been less inclined to go to the ER, et cetera. So it's created this perhaps pent-up demand for health services. And I'd love to know from all of you your perspectives on what that pent-up demand, how that will affect employers in 2021 and beyond. And Tony, could we start with you on that topic?
Yeah, I'd love to. I want to back up just a second about the electiveness. So Ascension Health Ventures is an investor in our company, and they represent 13 of the largest delivery systems in the country inside that venture fund. And early in the pandemic, this is about May, we asked them as part of the board meeting, could you kind of present what you're seeing on the front lines from a provider standpoint? And they presented some really interesting data. It wasn't just elective procedures that were down. Heart attacks were down. Strokes were down. Cancers were down. And what was so interesting was we had this conversation about that in the board about, is that because people, I mean, these diseases don't go away overnight. So something's going on that's funky. Is it because they just don't want to go and get the services done? Have we changed the stressors for some, like heart attacks? Have we changed the stressors for a heart attack? Is there something different about this environment? And the data is still muddy on all of these issues. But it isn't just the elective procedures that went away. There was a lot of different things that went away. Now they're starting to ramp back up. And I think, one of the things that is kind of the $64 million question in the insurance world right now is, how do you build pricing, for 22? And everyone knows 20 was, I don't want to make anyone angry, but if you were the insurance carrier in 20, because we did change the utilization demand for healthcare services in a really depressed version of that. Like we decreased it a lot. And then it started to open up a little bit in 20, at the end of 20 and early 21. But people now are saying, well, wait a minute, am I supposed to go back to where I really think it should be in price, 22 for, year on year 20 to 21, or do I use the underlying experience of 20 going forward? And I think the cautious people in the industry are recognizing there is pent up demand, and there is what we would call elongated acuity. There are people who should have been receiving services that weren't, and they're probably in a more acute state with their condition than they would have been if they had gotten the services when they should have. So I think right now, everyone is planning that it's going to be a big rate increase year for 22 and for 23. And employers are kind of bracing for that. A lot of the self-funded employers at least had the benefit of a reduced, benefit spend in 20, and it appears to be hanging on in 21 right now. But I think that goes away completely in 22 and even in the back half of 21. I think you are going to see the reality of there is more need for healthcare services than what's currently in the data.
Fascinating and really important to consider as employers are making budgets and making plans for the future. Trent, what are you seeing at Mountain America as far as the pent-up demand and how that's affecting you as an employer as well as your team?
Yeah, it's a bit of a tough one to get your arms around, frankly. And I don't know if I could say if I have a really great answer in terms of it's this. What I do think, we saw our claims data jump towards the last quarter, which it typically does as people hit deductibles and other types of things. So I think, and as ERs and other things, or not ERs, but surgical centers and other things start opening up to those things, I think more and more employees still took advantage of it. So what I'm still debating is, if it's like, yeah, I didn't get my physical, so I'm waiting till next year. Like I just don't know how to quantify how big it was. So I expect a slight uptick, but honestly, I'm not really projecting a huge uptick or a huge factor for 2021. We'll see. It'll be interesting.
That's one thing we've learned is none of us can predict the future, darn it. I wish we had that accurate crystal ball. Governor Levitt, your take on pent-up demand.
Well, I'll comment on in relation to actually healthcare providers. As Tony pointed out, it was a banner year for insurers because the demand for services was down. When in most cases, demand for services is down, it means business is down in healthcare situations. And so despite all the government money that went into trying to stabilize healthcare, many, particularly hospitals and clinics in underserved areas, went financially undernourished, and it has created a substantial strain on them. So we're likely to see a delayed response, but I think it's clear that there will be some instability within the ranks of healthcare providers, particularly in underserved areas.
Thank you. It'd be fun to do this panel again in a year and answer these questions we have about how it's going to go moving forward and how costs will increase or not. Let's move and talk about personalized health plans built around conditions and treatments, and how COVID-19 has maybe accelerated that or made that more of an important topic and a pertinent topic. Governor Levitt, do you want to start on that one, personalized health plans?
I'm anxious to hear Tony comment on this because I know he's got a lot of experience. It's not an area where I have a lot to add.
Okay, Tony, take it away.
That was a lateral, Tony.
All right.
He pitched you a softball, I think.
Yeah. So I think what's so interesting is, why did we even come in and try to invent personalized health plans? So like I said, 20 years ago, we invented the first account-based health plans that rolled over dollars and let consumers own that. And then, that converted it eventually into the HSA law when that passed. And I think one of the things that we noticed in the intervening 20 years is kind of what happened. And what happened, unfortunately, is a lot of employers and plan sponsors started reducing their commitments towards funding the HSA, and at the same time simultaneously increasing deductibles, leaving consumers with a bigger and bigger portion of what was the amount they had to pay to get their coverage to work. And the average American has a hard time. I think I forget the statistics specifically, but it's like a big number of people can't come up with an unbudgeted $500. And when you start looking at the plan designs that were kind of happening with CDHP, you're putting a lot of people into a state where they didn't feel like they had coverage. Combined with that is they were reading all of the situations that we see in the media, which is people with coverage getting bankrupted because they go and consume some service and they get a surprise medical bill that they can't afford. And so then people were like, whoa, this is kind of scary. And so what we decided to do is look at the problem from a consumer's perspective and say, well, how would you solve this? And it's kind of three things. The first thing you have to do is make coverage affordable, period, end of story. And that means you got to have things that are less than $500. Like you got to make things more bite-sized and available for consumers to use. So we create something we call price tags for every service that you want to consume. And those price tags, are knowable, which is the second thing that people were worried about, which is I can't navigate this system very well. I don't, 4% of Americans can actually explain correctly premium, coinsurance, deductible, and copay. And those are the four primary benefit design levers we all use. And only 4% of us, it's probably the insurance industry, by the way, who can actually answer it correctly. And so we were like, we got to simplify that, and you got to make it clear and knowable in advance and give them two simple signals. What's the premium you're going to pay, and what's the additional price out of your wallet you would have to pay for that service? And then have the insurance always subsidizing services. And that was really the third innovation that Bind built, was we eliminated deductibles and we eliminated coinsurance. And we said, we want to have first dollar coverage, but we're going to have subsidy change depending on what you're using and who you're using. And instead of just using this kind of what I call dumb subsidy, which says everything treated equal and all conditions treated equal, is just a really bad insurance design. And so when you actually put good insurance design in place, you actually start to change spend, because consumers, let me be honest with you, consumers like to feel healthy. And if you could show them the path about how to get there more efficiently and effectively and use price tags as the way to navigate that path, they get it really quickly. We do that in every other part of our lives. And so you just got to make it happen that easily in insurance. So, and here's the results of, the experiment we've been running for 4 years now with what we call personalized health plans. We have saved plan sponsors in excess of 20% of their costs. And this is, take COVID year and throw it out, because everyone's going to be down for COVID. This is like pre-COVID year, and then it's COVID on COVID year compared to traditional plans. And we're still beating those plans. The second thing is, we do that savings by actually also lowering the out-of-pocket spend by consumers. The average out-of-pocket spend for a Bind plan for consumers is $448. The national average is right at $1,000. And so we're at 50% of what the national average is for people to utilize their benefit. And only 0.5% of people on a Bind plan actually hit their out-of-pocket maximum. So we know it's working. And the other reason we know it's working is because we test with consumers on Net Promoter Score. Our Net Promoter Score was 38. It's the highest insurance published number we've seen in health insurance. No one's got a higher Net Promoter Score. And it's because consumers get the plan. I get to buy what I want when I need it, and you show me where are the right providers for this condition and the treatment services I need, and you help me navigate to that quickly with a knowable and understandable price tag that is the price I pay, and I know it in advance. And when you build coverage that way, that is how we use the system. I hate to offend people, but an accountable care organization is a health policy fantasy. When you look at the data, that's not how we use the healthcare system. We use this healthcare system in an episodic and intermittent way. A better way to describe episodic and intermittent is on demand. And if you actually build coverage to follow the on-demand use of how we use healthcare, you can actually get consumers to use healthcare in a more effective and efficient way.
Wow, that's interesting. I love that you have all those statistics right at your fingertips, right in your brain there. That's fascinating.
Well, I care about the company immensely, so we look at data all the time in the company.
Well, and it shows. Thank you for teaching us that. I'm sitting here thinking, if I took that quiz, would I be part of the 4%? And I don't know, but I've learned a lot from you already today. Trent, any thoughts on personalized plans from the Mountain America standpoint?
Yeah, a couple quick things. So I'm going to help Tony out because I come at a financial institution. This is 2019 data, so I'm guessing it's a little worse. But 2019, 76% of Americans live paycheck to paycheck, and 69% of Americans have less than $1,000 in savings. Pretty scary statistics. So just there you go, Tony. There's my support from a financial institution. I would agree with Tony that I think there's some real challenges, and I think it's incumbent upon us as business leaders to think about, how do we help our employees have meaningful choice? And I think that the way choices have evolved over time is interesting. And Tony's talking about, I think, some upcoming choices that Bind and some others offer that I think are really significant and worth consideration. A couple things to me that have driven that are changes in technology that are enabling this, and changes in legislation, quite frankly, that have enabled us to do this in ways that we haven't in the past. I think internally, so Tony's hit that very well. What I would say internally in our organizations is it highlights our need to be thoughtful about, an organization like mine, we've got, in all organizations, we have a wide demographic base. That could be age, that could be, exempt, non-exempt, frontline, office worker. It could be generational. And I think we need to be very thoughtful that these different generations and different people, they have different needs and different approaches. I think what we have to be thoughtful of as organizations is having a good core medical benefit plan that covers the core essentials, and then really using data and employee feedback. A lot of COVID, what's come out of this is, I'm a little skeptical to say this, hesitant, but I'll say it anyway. I think in some ways it's empowered a somewhat entitled employee even more so. They are going to have higher expectations of us as companies than they have in the past to meet their needs if we want to retain them. And so what that means to me is we need to be listening exceptionally well and understand that and take the data and translate it into something that's really actionable that can help them with plans. So what I mean by this is we're going to have to continue to offer some core medical benefits and then be thoughtful about the ancillary pieces. So things like child backup care, extended maternity and paternity leave, flexible scheduling, like all of those things are still related to this. So I would agree with what Tony said, but I'm saying that's the core. We'll need to be thoughtful about how we use data and offer things to employees that are of interest to them to fill out their personal needs. And I think a lot of that's going to come back to this, us offering choice that's meaningful and relevant to them based off data, and giving them, partnering with our providers to offer those choices. I think, some of the things that are personalized, Tony, just to highlight what he said, I know with our current insurance providers, we're partnering with both of them to offer more and more help to employees around how do we educate them on the options they have to get quality care at the lowest cost, right? Because A, it benefits them, it's dollars saved in their pocket, and B, it also helps us as an organization. One other thing that I think is a personalized thing that kind of was unique from COVID for us, we have a clinic on site, and when COVID hit, we have this clinic, and now what are we going to do? I mean, 80% of our corporate employees are out of the office. And so what we did is we focused on two things. We quickly transitioned to more virtual to offer to our employees, which I think was a huge win for us. But we also worked to look and focus efforts on certain groups. So for example, we had our clinic look at our one of our disease management groups, the diabetic group. And we've now created tailored programs where we're really focused in on that audience and helping them to be more prepared. And I think we're going to have to continue to make adjustments to these tailored groups to help them get the care that they need in the right way at the right time. And I think that's a lot of what I hear Tony focusing on of kind of we're managing to the outcomes. So that's what I'd add.
Could I just offer a policy observation? An employer perspective, we've heard an employee perspective, or an insurer's perspective. The reality is this is an issue that has grave and long-term consequences on everyone, because we're in a competition now economically with countries around the world to who can provide the best products at the lowest price. And the United States is at a serious disadvantage in that way. We are starting with healthcare costing about almost 20% of the entire economy, whereas our nearest competitors are 9, 10, 11%. So we start off with a dramatic price differential that means jobs. It means our capacity to compete as a country in a global market. So while this is very much about consumers and their relationship with their doctor and their insurance costs and so forth, if you roll that up to a macro level, we all have a big stake in ways to deliver care at the lowest possible cost.
Well, thank you for giving us some perspective on that. This is a really big issue. I didn't realize there was such a disparity between our country and others. We have a lot of things to figure out.
I'll give you just one example that I should have used earlier, and that is China. We all have our eye on China because of their capacity as a competitor. We have a cooperative relationship, but we're more and more in a competitive relationship with them. They spend 7% of their total economy on healthcare. Now, none of us would want to be in the Chinese healthcare system, but I would also add, they also have a longer average lifespan than we have now. Now, mortality is not a great measure of overall healthcare quality, but it is certainly an indication that they are providing at 7%, something that's costing us almost 20% of our economy, and it allows them to have a dramatic economic advantage. Now, there's not many people in China that lose elections over healthcare just because of their government system. My point is that they have a different system and we're competing in a different system, but if we're going to compete, we have to be that much better. And Tony's point is that we're now engaging not just employers, we're also engaging individuals to help be part of finding the solution for how you get the best care at the lowest cost, because they have skin in the game.
Absolutely. Thank you for sharing that with us. And this is such an important issue for us, but also our kids and grandkids as our country is moving forward. And like you compared us to China, there's a lot to consider and a lot of things that will impact us greatly. Let's talk about long COVID for a second. I'd love to know from your perspective, what impact you feel like long COVID will have on us as a community and also on employer-sponsored health insurance. Tony, do you want to start with that one?
Sure. Well, it's consistent with the pandemic in general, which is we're learning on the fly. And we are seeing there is a real effect about long COVID. We're seeing even daily, there's new things that are coming out about, oh, it's causing this in this population. It's causing this additional, morbidity item with this condition. And I don't think we're out of the woods yet. I think we're going to find more and more impacts about how this disease is actually differentially affecting people based on their underlying conditions and their health state. And it's something that Governor Levitt said at the beginning. The other thing that the pandemic and what COVID did is it did show that your health state, which you are largely responsible for, is going to affect how well you're going to do with this virus. And we have a virus that literally runs the entire gamut of experience. It does nothing to some people and kills others. And when you think about that spread of what it does, it's amazing. And now we've got people who, might not had a severe illness during COVID, but are now getting additional morbidities connected to some underlying condition that they're tying back to COVID. So I think long COVID is going to be a continued epidemiological, set of research that needs to be done about, what is it causing and why is it causing it. I think the new variants that are, on us now are going to even extend further the concern we have about what could this disease really represent long term. And I just think, the American public can't put too much faith into the vaccine as it solves it and all goes away. I think we're going to be hanging on to this issue for quite some time. And I do think, if you go listen to the leading epidemiologists, this is just one of a lot of things that are probably coming down the pipeline for us if we don't get serious about investing in public health as a way to prevent these kind of pandemics and these kinds of super bugs going forward. So now, again, that ties back to my comment about the rates and what insurance companies, they have to be the most, you might say cautious, you might say, egregious, depending on your point of view. But the insurance companies know they're going to be on the hook for all these expenses. And they're starting to say, boy, this looks expensive. This looks like it is going to be really expensive for us to fund all the services needed relative to what just happened with the pandemic.
Absolutely. And you highlighted the inconsistencies we've experienced with this pandemic. It's crazy and it's hard to plan around that because the inconsistent results are all around us. Trent and Governor Levitt, do either of you want to jump in on long COVID?
Well, I would say that of the HR leaders who are participating today as an audience, this may be among the most important issues that you begin to follow. There will be a lot of personnel issues about people who are not able to have work regularly because of incident related to COVID. I think we'll ultimately begin to see worker compensation issues that follow on a person who may have been infected at work and what responsibility, particularly in essential worker situations. I think healthcare costs are still going to be a bit hard to judge because we don't know what's coming. The truth is, we don't know a lot about this. We don't have enough data yet, but it's clear that it's very real, and all of us, I think, will be more conscious of it as time goes on.
Two quick things, Jeanette. Let's do a pop quiz for our audience. Where do you think healthcare benefits comes in as a driver for attracting talent? I'll give you the answer, but it's actually the number 2 most important decision. In the top 5 decisions that employees use to decide where they're going, healthcare benefits comes in number 2 right after compensation. So my point is this continues to drag on. We need to be thinking about these things because our employees care. If we want to attract good talent, which we know is one of the biggest drivers of our success as an organization, we have to take care of that. The other thing that I think about is, if you think about Maslow's hierarchy of needs, the first basic is kind of this safety, right? And so I think our employees are going to have to know that we are providing a safe environment. I know there's some organizations talking about, do we need to consider a safety and health officer or some of those types of things? I think those are real things that over the next couple of years, we're all going to be taking a look at. And I wouldn't be surprised if you see that popping up more and more in the near future.
Right, thank you. Thank you all for your thoughts on that. We have a lot to figure out, and today has raised as many questions as we've brought about answers, but thank you for your discussion. So with all of these changes, I'd love to know, as we come to this other side, or at least the other side of this first chapter of COVID, what do you think the major changes will be in employer-sponsored health plans? What do we want to keep and what do we want to leave behind as we move forward? Tony?
Well, I think Trent identified 2 very important things, and I just want to echo them. The first is, I guessed it right, it is number 2, and that's behind wages. And it's just so vitally important to people and they want to understand how the coverage works and what I'm getting. I think the more that employers are transparent about what they're doing and funding and how much they're supporting needs to become more real to consumers. Sometimes I think, it was funny, I was at a large Fortune 500 company and I was running an annual enrollment event, and it was an audience that was combative with an insurance executive. And it was interesting because they had this notion that I was the insurance company for this Fortune 500 company. And I had to say to them, look, I'm not your insurance company. I'm just your administrator. You are the insurance company. All of you in the audience right here are the insurance company. Your employer is acting as the intermediary for you to have insurance, and they're paying the bill. And you should have seen how wide-eyed people were in that meeting. They did not know that. And it gets back to Governor Levitt's point about the competitiveness that America needs to have, which is this benefit has to get more affordable, and it has to be, if we're spending 20% GDP and we did have, more presenteeism, healthier people, lower BMI, less, incidence of disease, we'd all feel good about that 20% spend. We don't have that. We're nowhere near that. And I think we as employers, we got to stop hiding behind this reality of not telling consumers how it really works. Because when they don't understand how it works, they think to what Trent's point was, this paternalistic problem, they think someone else is in charge of it. And the more we distance people from the ownership that they own their own health, the worse we have about getting them invested in how do I improve it. And so I think that's one of the things we encourage all of our employers to just be transparent about how the system really works so that consumers can understand it. I think we have to make it more affordable. You can't give a $2,000 deductible to someone making less than $50,000 a year. That does not make sense. They do not have health insurance. They don't feel like they have health insurance. And you've got to, and then the other thing you need to do is you need to build an equitable benefit. And it's so funny because the decision makers in some of these big employers, they're very highly compensated executives. They're very affluent, they're very educated, and they feel like their view of the world is what it looks like for their entire workers. And that's not what's happening. And they think the HSA is perfect for everybody, and it's not, because it doesn't work for a broad majority of Americans who can't come up with the dollars that Trent referenced. So to me, you got to get serious about, like, really tackling insurance design and being overly communicative about how benefits really work in your company. And it's a balloon. If I spend more on benefits, I have less for wage improvement. I have less for all the other programs you want me to go spend. And if my health benefits keep eating up, it's what, Warren Buffett calls the American tapeworm. And if it keeps eating up all the other discretionary things I could do as an employer, it doesn't feel good to consumers. And so it benefits employers to get consumers engaged with how do you, as a participant in this program, help change the way it works. And the more you do that, the more, like I said, most people want to feel healthy, are unhappy with the state if they are unhealthy, and they want to get back to figuring out how they can go do that. And building a benefit structure that makes that intuitive and understandable for them and gives them the access points they need, whether that be virtual, whether that be a wide open network, the better the benefit plan is going to be for an employer.
Yes, thank you. And Trent earlier talked about how employees are becoming more and more entitled, which is difficult when we really need them to take more ownership of their health and take more of an interest in it. Governor Levitt, thoughts on things we want to keep, things we want to leave behind as we move to this next chapter of life?
Well, we are clearly moving into a new period in healthcare, and the pandemic has driven that. I think we're going to see changes in the way healthcare is delivered. We spend a lot of time talking with folks that I advise about asset-light delivery, developing many more ways to reach consumers using technology as opposed to using bricks and mortar facilities, for example. I think we'll begin to look for ways that will allow us to deliver the essential service at the lowest possible rate. And there are so many different incentives to do that, we won't take the time to account for them. Tony's mentioned some already. So I would just say we're in a competition as a country. And the competition is, can we as a country maintain our productivity and do it in a way that we're still competitive? And while your own health plan may not seem part of that, it's very much part of your future. And it's part of your children's future, because we're on the verge as a country, in large measure because of healthcare or because of the cost of healthcare, beginning to lose our economic leadership advantage. You can see where other countries, I named China, they're not the only one, who are able to deliver products and services in a high quality way at a lower cost. And part of it is their willingness to accept a healthcare system that we wouldn't accept. I'm not advocating for that, but it's an equation, and we have to learn to solve this. Every generation has a challenge that allows them to declare and to receive themselves as the number one player in an economy. This is likely the US challenge, and it's likely this generation's challenge to figure this out.
Thank you, Governor. I feel inspired to learn more and to really realize the gravity of what we're dealing with. So thank you for helping us understand that. Trent, we're going to give you the last word here. What are things that you want us to keep, or things you think we should leave behind as we move into this new era of healthcare, as Governor Levitt described it?
Well, so Governor Levitt's done a great job of articulating it on a macro level. So let me talk about it at a business level. We always look at it, the way I think a lot of HR leaders or those that are making decisions around healthcare for companies, we're always trying to find this balance between employee care and cost. And really, there's kind of four key areas where you can focus to reduce cost in healthcare from my point of view. There's administrative expenses, there's physician spending, hospital spending, and pharmacy spending. And I think that, most organizations typically focus on the first two. And so my point is we do need to focus on this. If you look over the past 3 years, most companies have had a 5 to 9% increase in their healthcare cost year over year. Most leaders project a 5 to 9% increase over the next 3 years. So it's a legitimate issue that we need to address. To Tony's point, a lot of this is kind of in the physician cost. And I would agree with Tony, if you step back to several years ago, the HMO plan was really trying to help contain costs. The issues with it is you didn't have the information available to you or the network to make good choices, informed choices. today, when we have products like Bind or Simple Pay, or there's other types of systems out there that get at this, they're really helping employees make good choice. And I do believe they are the way that we're going to go. I see that with some of our current, insurance partners. They are working aggressively to partner with us on how do we help reduce costs. There's other organizations like Accolade. There's a lot out there that are all trying to drive the same thing, drive down costs. And what I think is great is with the legislation changes and technology, I actually think we are now at a precipice where we're going to start making these changes. I think Bind is definitely at the forefront. I think there's other companies that are moving in that direction that are doing some good things that I think are really going to help us move there. So I'm excited about it. And I think we as HR leaders definitely need to be thinking about it, assessing these tools and going out after it. Another place I think we just need to look at for the future that's an unknown for me is, with the new administration, the Cadillac tax, something pushed back till 2022. Man, that could have some interesting implications for us. Supreme Court has deferred a lot of ACA challenges. They're going to come up, so I think there's a lot of interesting things in our political environment right now. Governor Levitt could probably speak to a lot more of those than I can, but I think there's a lot that we just need to be aware of and understand what's happening, because they are going to impact us, and we need to keep managing what's happening and keep our costs down while not diminishing the employee experience.
Thank you, Trent. I loved your excitement and you're feeling positive about the future. I think that's a great place for us to end. Our time has come to a close, but I want to thank all three of you, Governor Levitt, Tony Miller, and Trent Savage, for being here today and sharing your expertise and your years of wisdom in this industry. So thank you for being here, panelists, and thanks to those who joined us.
Thank you for joining employer-sponsored health plans in a post-pandemic era. To join the conversation, follow Bind and GBS on social media. We hope to see you at future events.